Suicidal thoughts can be scary. If you ever experience suicidal thoughts, having a safety plan is important. This is a step-by-step plan you can use to keep yourself safe during a crisis. A safety plan guides you through personal coping strategies and sources of support, giving suicidal thoughts time to decrease and become more manageable. While the free Safety Plan app can be used on its own, creating your plan with a mental health provider can be helpful. Let's look at how to use the app. There are 6 steps to creating your safety plan. It is important that you create your safety plan when you are not in distress, so you can think clearly and have time to complete the steps. In the first step, you'll add warning signs. These are thoughts, feelings, behaviors, or physical sensations that show up at the beginning of a crisis and remind you to use your safety plan. One of the most effective ways to prevent a crisis from getting worse is to recognize your warning signs early so you can take action before the crisis gets worse. Select the warning signs you've experienced in the past. Warning signs are most helpful when they are specific to you, so be sure to add your personal warning signs. If you have questions about this step or any other section of the safety plan, click on the question mark icon to see answers to frequently asked questions. Once you've completed your warning signs, move on to step 2. This step helps you explore strategies that you can use to cope on your own when you notice that you're heading towards a crisis, allowing time for your suicidal thoughts to pass. What have you done in the past to take your mind off of suicidal thoughts? Try to be as specific as possible. You can add your own strategies or add a tool from the app to your plan. Save your selections, and when ready, go on to step 3 of the safety plan. Here you will create 2 lists for social distractions, places you can go and people you can call to help distract you, allowing time for suicidal thoughts to pass. First, think of a place you can go to distract yourself until your suicidal thoughts subside. Think of public places, groups, or social events. Safe and specific locations are best. Second, think of people you can reach out to who can distract you from your crisis. These do not need to be people with whom you feel comfortable sharing that you are in crisis. Instead, choose people who are good at helping you take your mind off your problems. You can pick from your phone's contact list or create a new contact. Step 4 is identifying people you can call for support. People you can really open up to, like family members, friends, neighbors, and spiritual leaders, who are likely to be available and can support you during a crisis. It's okay to list the same people here that you listed in step 3. If you don't have anyone you feel comfortable including in step 4, move to the next step. In step 5, you'll create a list of trained medical or mental health professionals and agencies that you can contact in a time of crisis, including doctors or mental health care providers you already know. Step 5 also includes links to emergency resources like urgent care, 911, or the Veterans Crisis Line, which can be reached by dialing 988 and then pressing 1. The final step is to identify ways you can make your environment safer and choose people who may be able to help you secure your environment. One of the most important things you can do when having suicidal thoughts is to put time and space between yourself and dangerous objects. Doing so will allow time for suicidal thoughts to decrease. First, think about items in your environment that you could use to hurt yourself, like firearms, medications, or ropes, and decide what you can do to make it harder for you to easily obtain, access, or use potentially lethal means during a crisis. This could mean safely securing them or giving them to someone for safekeeping. You can select any of the items listed or write in your own. Next, add people who can help you secure your environment. These should be friends or family members who can help you during a crisis and with whom you feel comfortable sharing your safety plan. And with that, you've completed your safety plan. Now let's learn how to use it. Review your entire plan by scrolling through steps 1 through 6. Use your plan when you start to notice the warning signs from step 1, or whenever you think it might be helpful. If one step is not helpful, go to the next step. However, if the crisis improves after following a step, you may not need to keep going with the other steps. You can also skip steps if you think you're in immediate danger, like skipping directly to emergency resources or professional help in step 5. It's a good idea to export a copy of your safety plan so you can share it with people who are supporting you. This could be people included on step 4 and your healthcare provider. Now that you've completed your safety plan, let's talk about the other features of the app. In the Reasons to Live section, you can make a list of your own personal reasons to live. You can insert text, images, video, or audio. The app has several images and videos to choose from, but you can also upload your own from your camera roll. Be sure to add a note reminding yourself why you've chosen each reason and what it means to you. You can also access support tools by clicking Get Support. You'll find crisis resources including links to dial 911, poison control, and the Veterans Crisis Line, which can be reached by dialing 988 and then pressing 1. Or other resources like the National Domestic Violence Hotline. There's also a section to help you find a therapist. If you have any questions about topics like safety plans, calling a crisis line, or how to manage tough emotions, visit the Learn section of the app. Here you can find guidance on things like how to ask for help, including practical tips on what to say. You can use Safety Plan to track your mood and progress towards your goals. Under My Journey, you can check in on your mood, add journal entries, update your goals, and track your well-being, anxiety, depression, or PTSD symptoms. In the main menu, you can set reminders for using the app. We recommend that you regularly review and update your safety plan so you have the most helpful steps in place to protect yourself in a crisis. There's also a section with resources for loved ones and providers. Here you'll find information you can use if a loved one is having thoughts of suicide. Remember, all data entered into the app is private and secure. During a crisis, it can be hard to think clearly. It's important to have a plan in place before you experience a crisis so that you can keep yourself safe until the thoughts pass. Safety Plan is here to help. Download Safety Plan today and start building your plan.